When I first started, we were just, one of the goals and mission was to develop a heart program. So we did not have a heart catheterization lab. There was no open heart surgery, and we just had an ICU. And so initially it's development and improvement of the intensive care unit, the nurses training, and what heart care is about.
At that time also, Texas had this thing called a certificate of need process. You had to go to the state in Austin and demonstrate that a program was needed in a region before you were allowed to actually implement it. And that included something like a cardiovascular program, but even before you could buy the equipment, like a cardiac cath lab, you had to go to Austin and get a certificate of need. So we prepared our argument. It was an easy argument to make. I mean, the need in East Texas was huge. The opposite pole was the people said, we desperately need this. We've got people whose lives are literally being lost because of the lack of access to cardiovascular care.
There was very little initially we could do for a patient with a heart attack.
August of 1983, I did the first cardiac cath. They were performed at Mother Frances Hospital. And about 2 weeks later, we'd done by then several cardiac caths for diagnostic purposes. Again, there were no stents, there was nothing else in the armamentarium at that time. But about 2 weeks later, Dr. Kapusta did the first open heart surgery on one of our patients. We hoped we would do 75 hearts in our first year of work, and we thought that was a bit of a stretch. A lot of people said that's not going to be possible, and we did over 150 that year with just excellent outcomes, and the rest is history. It's grown ever since then.
And nowadays, we could stop heart attacks from happening. We don't have to just put them in bed and hope for the best. We open up clogged arteries. The issue of time is muscle. In other words, the longer you have the heart attack, the more permanent heart damage you'll have. So if you could get the patient to the hospital quickly, into the heart catheterization, get the artery open real quickly, you can minimize the damage or to have very minimal or no damage. That has ultimately resulted in shorter hospital stays, healthier discharge, less incidence of what we call ischemic cardiomyopathy, heart failure, and weak hearts due to heart attacks, because you've saved the heart muscle, you saved the tissue. We have now to the point where we could do a lot more stenting to smaller vessels or harder to reach because the equipment is better. We could replace a valve for aortic stenosis by going through the groin instead of open heart surgery. We can repair mitral valves through the groin. We can put devices in to prevent the clots forming in the heart. We're doing intervention and opening up blood vessels of the feet, legs, where before it required amputation.
My message to folks is take care of yourself, find a primary care clinician you trust and respect. Don't hesitate to communicate needs, concerns, anxieties. Get the care that you need and deserve, and be certain that you're treating things that you know will prevent future problems in there. And then beyond that, we're here to help.
What I love about my practice is people. Knowing that patients are improving, feeling better, I'm helping them, that means a lot to me. I mean, I've had patients that I've been following for 35, 40 years, and they're almost like family.
Becoming part of CHRISTUS, I think, was a really important step in our journey in cardiovascular care. It really gave us that ability to develop strong heart surgical programs in Longview and in St. Michael's, or to continue to develop what were already strong surgical programs there. And we're one team. I view our goals as reaching that population where they live and work together collaboratively to just improve the health of Northeast Texas. That's exciting, and I don't think that could have happened had it not been for CHRISTUS. Dr. Israel's group, the long-established cardiology associates of East Texas, or CardioStream, are now joining Trinity Clinic Cardiology, and come April 1st, they'll become members of the CHRISTUS Trinity Clinic and Trinity Clinic Cardiology. The CHRISTUS journey has been a great one, and I'm excited to see where it leads next.